Alright guys, so we are gonna start all these questions, and I cannot believe I am barely filming this even though I've had my boob job since 2018. Okay, so Denise G says, on a scale from 1 to 10, how painful was your recovery? Honestly, I think day 1 it was just a lot of pressure, so I would say maybe a 4, and it was just because I felt pressure. And then day 2, 3, 4, it was really hard to even like open a water bottle. Like I felt like I couldn't use my hands at all because it just all, obviously it's all connected, so it just felt like we are not doing that. How long was your recovery? Example, where were you able to get up and do all things? I felt like by day 5 I was good. I was able to go to the kitchen, kind of like move stuff around, do my bed kind of. By day 7 I was like, let's go to the mall. I remember, and Benny still makes fun of me till this day because I wore the hoochiest shirt that day to the mall. Like I looked like I was going to the club, but it was like, I'm out, we are out. So he will still make fun of me. Like, and I have a picture actually of that day, and I remember I had both girls already, so it was me, Benny, me with my boobs all out, and my babies. Details before and after are super helpful. I am gonna put these pictures, I promise. What size did you get? I got 360 cc, and I got no lift. It was just the implant put in. I actually have like a tiny little scar. That is my scar, that little like dot that you guys see. That is right here. So I got it under my boob, 360 cc, and I got moderate profile. So yeah, like I was telling you guys, I got moderate profile. I know they sit like a little bit high, but I believe that it might be because I got them under the muscle. So that's a question that I'm gonna actually ask Dr. Hayavi, like, because I have other friends that have gotten them done, and they had told me like they're gonna drop. And I feel like since I got them done, like when I got them done, yes, they were like maybe up here, but honestly I don't feel like they dropped a lot. I feel like when I wear bikinis, it looks like I just got them done. I don't know if it's a small implant or the fact that I got them under my muscle. Who knows? But I got moderate profile, 360 cc under the boob. Okay, so I have another question that says, any side effects? No, not that. I know there are some women that are a little bit more sensitive to implants that have gotten sick from them. For me, my energy levels have still stayed up. Keep in mind though, I do work out. I try to eat as healthy as I can, so I have not had any side effects with my boobs. Where did I get them done? Rancho Cucamonga with Dr. Haiavy. Okay guys, so funny story about me getting them done in Rancho, right? So to me, I was like, it's perfect. It's like 25 minutes away. I got them done early in the morning. I think it was 6. And Eloise did not get out of school till 2. So I was just like, I'm gonna get out of surgery and I'm still gonna be able to pick her up. Anyways, that did happen. Like my surgery was quick. I got up pretty quick, like the anesthesia came off, and I was able to go. I get on the freeway to come home. Tell me why there's a fire, and we're right there on the freeway, and they like closed down the street, like literally. Our car was like the first one where the cops were like, no, like you gotta wait, like you can't go, there's a fire. And I was stuck there for an hour, and I had to pee, so I like walked my ass to the so yeah, you guys, I'm laughing because it's just crazy like what I went through. I'm over here with, when you leave the surgery room, you're essentially in a cast and you don't look your best. So it was a hot day as well, so I remember like walking to the gas station thinking like, this is not my life. This is not happening. These people are not looking at me like this going to the restroom. Keep in mind, it was just Benny and I. He couldn't go with me. He couldn't just leave the car. So I was by myself. Anyways, I walk to the gas station and I use the restroom. There was so many people in line because it was just so many people that were waiting to just get back on the road. I pee and I'm walking back. And as I'm walking back, Benny's like, let's go. They just opened the freeway. Hurry up. So like my last steps, I'm like running. Okay, so another good question, cost, recovery time, and pain level. The cost at the time, so you also have to see like every year the prices change. Every surgeon has different prices. So my price was $6,700. Keep in mind as well that I only got a breast implant. I didn't get a breast reduction. I didn't get a breast lift. All I went in for was a breast implant. Both the implants were exactly the same size. That's all I did. When you add stuff, it's gonna go up more. So my price, $6,700. Recovery time, a week. Pain level, 3 or 4. This is a really good question. Were you too scared to go too big or too small? Yes, I was. Originally, I was gonna go big, and then I changed my mind and I went small. We were gonna do 450 in the beginning, and then I was just like, no, like I'm so scared to have big boobs. And I ended up doing 360, which honestly, I'm so happy. I'm so happy with my size. That was another question actually, if I'm happy with my size. And yes, I am so happy because my goal was to be able to have, you know, like some sort of cleavage, but I also wanted to wear stuff where I didn't want people to always like put the focus on my boobs. So when I work out, like there's stuff that I wear and you can't tell I have my boobs. When I don't want to show them, I wear dresses and I can wear them and my boobs are not like sticking out. So that was my overall goal for me. I had another good question, and they asked what type of implant that I got, and the type of implant was this one, Natrel, I believe that's how you say it. And again, it shows you guys right here that I got on my left 360 cc and on my right 360 cc's, which here we are. This is what they look like. I'm gonna show you guys what it looks like when I just put on like a regular shirt. Like you really can't tell that I have my boobs done, which I love that, just natural look. Okay guys, so now I have a dress on that was similar to the shirt that I had on, and look, this is what I mean. Like this is the look I wanted. I can go to, I don't know, my daughter's school and it's not like my boobs are just like bam out there, or a wedding and it's like the focus is not my boobs, you know. So that is what I wanted. I wanted to be able to wear things like this to where, yes, if I want to show my cleavage I can, but if I don't want to and I want to wear something that is a little bit more of a classy look, I'm able to also pull it off without feeling hoochie. That is the word I was looking for, hoochie. I don't like feeling hoochie. So this is why I got such a, I would say small. I think 360 is fairly small. If I could do it again, would I go smaller? Maybe, honestly, maybe. So that was all the questions. There was a lot of questions, but they were all pretty much repeated. I don't want to bore you guys, so I really hope you guys enjoyed this video, and I can't wait to make more for you guys this year. Morning guys, we are here with Dr. Hayavi, and we have some questions for him that you guys sent me on my Instagram. One of the reoccurring questions was, can you do fat transfer to the boobs and does it last?
So that's a very good question. Fat transfer is definitely a tool, but with fat transfer there's a caveat. Not all the fat that we put in survives. And usually we say about 50% will take and 50% will go away. So And at best case scenario, right, you can get a gain of half a cup to 1 cup size. Whereas with implants, you can gain 2 or 3 cup sizes. So it depends on what's the goal. If somebody wants a very natural, very small augmentation, replacing some of the volume they lost, yes, it's a good option. Or if they cannot tolerate implants, fat transfer is appropriate for someone that wants a small augmentation and does not want to deal with an implant. Sometimes you have to repeat it. You have to do it a couple of times. And I was saying that for patients that have implants and have some areas of irregularity, or they've had capsular contracture and they want to fill in some defects, that's a good option.
Yeah. Should I lose weight before coming to consult a breast augmentation?
So, with any surgery, we want you to be at your ideal weight. If somebody is planning to lose just a little bit of weight, like 5 or 10 pounds, that's insignificant and doesn't make a difference.
Okay.
But if you're planning to lose significant amount of weight, let's say 20 to 50 pounds, it's best that you lose the weight before surgery, because it may change the treatment plan.
Mm-hmm.
Somebody that loses that much weight may need a lift, they may need a bigger implant to
Yes.
fill up the envelope. So it will change the dynamics of our treatment planning. So yes, I would say if you're planning to lose significant amount of weight, lose it before surgery.
Got it. Okay, next question from Norma. For a full lift, which type of breast implant do you recommend? Saline or silicone?
Okay, thank you for the question, Norma. Really, it doesn't make a difference in terms of saline versus silicone. The saline versus silicone with the lift is really dependent on your anatomy. So if somebody who's very thin, doesn't have much to cover the implant, most probably they'll be better candidates with a silicone implant. If somebody is thick and wants more firmness and more fullness and just wants a firmer look, then I would recommend saline. But really it depends, it's a personal choice. We'll help you make that choice when you come in. Based on all the measurements and exam and what you desire, we'll steer you to the right direction.
Okay, and another good question from Alex. Do you have to replace implants after a certain amount of years? I feel like when I was looking into it, it was very like, you have to do it every 10 years.
The general, statement we make is that you have to check every 10 years.
Okay.
It doesn't mean that you have to replace them.
Got it.
I've been in practice for 22 years now. I see my patients coming back after 18, 19, 20 years,
really?
21 years.
Yeah.
And I'll tell you our percentage, because we measure all of this. Only about 14% of my patients need surgery at 10 years. 86% don't need anything done. They come in, we check them, they're fine, they go home and they're fine.
Yeah.
We just check every few years.
What exactly are you checking when you're...
So we want to make sure that they don't have capsular contraction, that hardness around the capsule.
That's why you guys, I remember when I left the surgery, you're like, make sure you're massaging.
Right, breast exercise is very important. So that's one. The other thing is we want to make sure they don't have, laxity or their tissues just by aging and losing weight, gaining weight, tissues drooping over, so they don't need a lift.
Okay.
And replaying, things like that. So if there's any issues, of course, we replace the implants, but if there are no issues, my philosophy, if there is no harm, don't do nothing. Why?
Exactly.
Yes, necessary surgery.
And the last question is, what's the average price range for a boob lift augmentation?
So a breast lift augmentation, it really depends, because there's so many variables, right?
Yeah.
You can have just a tiny little lift where we're taking some skin off above the nipple, or you can have a whole, what we call an inverted T or an anchor lift.
Yeah.
So that's a big difference. And also there's different types of implants, right?
Yes.
Saline, silicone, and then silicone. There's different types of silicone implants. There is the regular, cohesive gel, then there is more cohesive.
Yeah.
There are implants that are called boost now, that are super, round and perky. So all those variables make a huge difference.
And then every year it changes as well with the prices. And
right, and it's not a, augmentation and lifts, everything that we do is kind of like science and art mixed together.
Yeah.
It's not a cookie color thing.
Yeah.
So it varies. So I think, that's a tough question to answer. I think the best option is really come in, see us, get a consultation, and then we can give you an exact price and we can break it down. I think that's the best way. In general, I mean, breast augmentation and lifts can vary from 7,000 to like 15,
Yeah.
20,000. It all depends on what we're gonna do, right?
Yeah. And don't let the numbers scare you guys. They do finance. They work with you. So
Yeah, I think financing is a great option. I would say probably 1/3 of our patients finance their surgeries. And one thing I want your audience to know, when you're doing surgery, it's your body. Cheap surgery is not the right way to go. I mean, revision surgery, if somebody, has done a breast aug and it was not done the proper way, to get to fix it is almost 2.5 times the cost of the
Yes.
original surgery.
not only that, putting your body through that trauma
Right.
is hard. And
Right.
knowing that you lost out on money, now you're gonna pay more to
fix
that.
it.
Yeah.
Right. So cheap surgery is not necessarily good. So do shop around, of course, do your research. Make sure that whoever you choose is skilled and experienced in what you want to do. And of course, reach out to your friends. I
Yeah.
think the best, way to really find good people is
Yeah.
to talk to your friends.
And recommendations, because I know I came here because of my hairstylist, and I've had friends that have came to Dr. Hayavi, and all of us have been very happy with our results.
Yes, thank
So
God.
thank you for meeting me. Thank
Yes,
you
of
for
course.
answering
Yes,
these
thank you for
questions.
coming out and doing
Of
this.
course. I
Happy
feel
to
like
do it.
I'm always here now.
It's great. We love having you.
Yeah.